Good morning, everyone, and welcome. Today, we're going to explore an important topic, understanding and addressing youth conduct problems. We'll dive into the causes behind these challenges, examine their consequences, and discuss effective interventions. I'm looking forward to sharing comprehensive insights that can help us better support young people facing these issues. Let's get started. Children's conduct problems are more than just individual challenges. They represent a significant societal concern. These behaviors, if left unaddressed, often serve as early warning signs for more serious issues down the line, such as juvenile delinquency and even adult criminal behavior. Understanding and addressing these conduct problems early on is crucial because it can help prevent a range of negative outcomes, not just for the individual, but for the community as a whole. This makes it imperative that we take these issues seriously and focus on effective interventions. When we talk about conduct problems, we're referring to a wide range of behaviors that are considered inappropriate for a child's age. These behaviors don't just go against what families expect, they also break social rules and can even infringe on the rights of other people. It's important to understand that conduct problems cover a spectrum. On the milder end, you might see things like whining, swearing, or temper tantrums. But they can also escalate to much more serious acts, such as vandalism, stealing, physical aggression, or even setting fires. Recognizing this range helps us grasp the complexity of conduct problems and why they require different approaches depending on their severity. When we look at antisocial behaviors in youth, it's important to understand the broad economic and social costs they impose. These behaviors strain multiple systems, including criminal justice, healthcare, education, social services, and mental health. Even though only about 5% of children show early, persistent, and extreme antisocial patterns, this small group is responsible for over half of all crimes and a large share of clinical referrals, highlighting the significant impact these individuals have. One alarming statistic is that firearm injuries among youth cause more deaths in teenagers than all diseases combined, underscoring the seriousness of this issue. From a legal perspective, conduct problems are often seen as juvenile delinquency, criminal acts that involve the court system. Psychologically, these behaviors are viewed along a continuum of externalizing behaviors, which include rule-breaking and aggression. Psychiatrically, conduct problems are categorized as mental disorders, namely oppositional defiant disorder and conduct disorder, according to the DSM-5. The public health perspective brings all these views together, focusing on prevention, early intervention, and community involvement to reduce both injuries and the broader social costs associated with youth antisocial behavior. This integrated approach is crucial for creating effective strategies to support affected youth and their communities. Oppositional defiant disorder, or ODD, is marked by a consistent pattern of certain behaviors. These include an angry or irritable mood, frequent arguments or defiance toward authority figures, and sometimes vindictive actions. Importantly, these behaviors need to persist for at least 6 months to meet the criteria. Understanding this helps us recognize the ongoing nature of the disorder rather than isolated incidents. Youths with conduct problems often face several associated challenges that are important to understand. First, many of these youths have cognitive and verbal deficits. They tend to score about 8 points lower on IQ tests, especially in verbal abilities. This can make it harder for them to control their impulses, regulate their emotions, and empathize with others. Second, school and peer problems are very common. These youths frequently struggle academically. They might fall behind in grades, be held back, require special education services, or even drop out. Suspensions are also more common, especially when ADHD is present as well. On the social side, these youths often experience peer rejection and bullying, while also forming friendships with other antisocial peers and getting involved in deviant peer groups, which can reinforce negative behaviors. Finally, the family environment and health risks play a significant role. Many come from unstable family situations, with issues like marital conflict, parental mental health problems, and inconsistent or harsh discipline. Limited supervision and a lack of warmth at home, along with household chaos, are also frequent. These factors contribute to higher rates of injuries, substance abuse, risky sexual behavior, and even premature death compared to their peers. Understanding these interconnected characteristics helps us better address the needs of youths with conduct problems. When we look at disorders that often occur alongside conduct disorder, several important patterns emerge. First, ADHD is present in more than half of children with conduct disorder. This likely reflects shared underlying challenges, like impulsivity and difficulties with self-regulation. However, it's key to remember that ADHD and conduct disorder are still distinct conditions, each with its own symptoms and patterns of impairment. Depression is another common companion to conduct problems, affecting about half of these young people. The connection is closely tied to the negative mood symptoms often seen in oppositional defiant disorder, which helps explain why depression is so prevalent. Anxiety plays a more complex role. In some cases, anxiety linked to fearfulness and inhibition actually seems to protect against conduct problems. But anxiety related to negative emotions and social withdrawal may actually raise the risk. Looking specifically at girls with conduct disorder, they are more likely to develop depressive or anxiety disorders by the time they reach early adulthood, highlighting the importance of gender-specific considerations. Finally, it's important to note that adolescent conduct disorder itself is a risk factor for suicide, especially among those with a family history of depression. This underscores the critical need for early intervention and monitoring in these cases. Oppositional defiant disorder, or ODD, has a lifetime prevalence of around 12%, and it tends to be slightly more common in males. Conduct disorder, or CD, affects about 8% of the population and is particularly more frequent among boys during childhood. When we look at gender differences specifically in conduct problems, boys are 2 to 4 times more likely to exhibit these behaviors than girls during childhood. They also tend to start earlier and have more persistent issues. However, as children reach early adolescence, this gender gap begins to narrow. This is because girls start showing more covert and non-aggressive antisocial behaviors, which often go less noticed but contribute to the overall picture. Understanding these patterns helps us tailor prevention and intervention efforts for both boys and girls. Conduct problems are influenced by a complex mix of factors, starting with genetics and prenatal conditions. Genetics play a significant role, accounting for about half of the variation in antisocial behavior. This influence is particularly strong in overt aggression and traits that persist throughout life, such as callous unemotional characteristics. Prenatal issues like low birth weight, malnutrition, exposure to harmful substances, and maternal drug use also contribute to these problems early on. Moving to neurobiological and social cognitive aspects, certain brain systems can increase risk. For example, an overactive behavioral activation system paired with a less responsive inhibition system can make it harder to control impulses. Additionally, low cortical arousal and dysfunction in areas like the amygdala and prefrontal cortex impair emotional regulation and social understanding. On the cognitive side, children may misinterpret social cues as hostile, struggle with problem solving, and tend to choose aggressive responses. Finally, family, peer, and broader environmental factors play crucial roles. Harsh or inconsistent parenting, lack of supervision, and family stress or instability create a challenging home environment. Peer relationships can either worsen or buffer these issues. Early aggression or rejection by peers, or joining deviant peer groups, can exacerbate conduct problems. Beyond the immediate social circle, neighborhood conditions such as poverty, crime, and gang activity increase risk. Cultural attitudes that normalize aggression and media exposure to violence also contribute, reinforcing antisocial behaviors as acceptable or expected. Together, these factors interact to shape the development and persistence of conduct problems. When we look at treatment and prevention strategies for conduct problems, several approaches stand out. First, parent management training, or PMT, equips parents with practical skills to change their child's behavior at home. It uses techniques like contingency management to improve communication, consistent discipline, supervision, and positive reinforcement. This approach is most effective for kids under 12 but can be adapted for teens. Next, problem-solving skills training, or PSST, targets how children interpret social situations. It helps them think through social problems carefully by teaching steps to evaluate situations, come up with alternative responses, and choose non-aggressive solutions. PSST can be used on its own or alongside PMT for more comprehensive support. For adolescents facing severe conduct issues, multisystemic therapy, or MST, offers an intensive intervention. MST addresses challenges across multiple areas, including family, school, peers, and even the justice system. Research shows MST reduces delinquency, lowers recidivism, improves family relationships, and is cost-effective. Early intervention and prevention programs also play a crucial role. Programs like Incredible Years and Fast Track focus on at-risk young children and their families, aiming to prevent problems before they escalate. These programs have shown promising results, particularly among high-risk groups. Ultimately, the success of any treatment depends on the severity of the conduct problems and how well interventions target the complex risk factors present in family, social, and community contexts. Tailoring approaches to these factors increases the chances of lasting positive outcomes.